Here we are again with part two of our great conversation with Dr. Josh. Tina, you learned a lot in the first one.
So much.
All right, so stay tuned.
Well, it's interesting because I don't remember ever knowing or hearing of people that were younger getting Alzheimer's until here recently. I literally have 3 friends. And so it's really hit me hard, one of which I hadn't seen in a long time. And I saw them Sunday, 56 years old. And he's in moderate Alzheimer's. And I'm just blown away. And my family, my daughter's boyfriend, his mom is 53 dealing with this. And so as I'm looking at that, I'm like, okay, if we could really reverse it in these younger age people, especially because they are young, is there more chance with someone in their 50s to be able to reverse it? Or does age matter where that's concerned, Dr. Josh?
Right.
Or is it more the person?
So first of all, I agree with you. I'm seeing people younger and younger getting Alzheimer's or other dementias, and it's concerning. But I think if they're younger, it's easier to reverse this and to prevent this. But the key is it's not just your chronological age; it's your biologic age. If you happen to have high levels of these fatty toxins and heavy metals that are prematurely aging your cells and in different organs in your body, then the reality is even though you may chronologically be 56, if those toxins, those fatty toxins, could make it seem like your body is 76.
Wow. That's interesting. And do you think there's any relevance? I've heard from, a lot of the research I've been doing in the last few weeks of how statins play a huge part in it because so many people are getting on statins. Do you think that has any relevance?
Yeah, so let's talk briefly about statins. And first, I'll say this is a controversial topic. I'm just sharing my experience. Well, I also have 2 degrees in biochemistry, 2 degrees from Harvard. I'm not your typical physician, but my understanding is, unfortunately, statins are mitochondrial disruptors. They will do damage to the parts of your cell that produce energy and, oh, by the way, remove toxins. So, but if you look at physicians, the standard of care today, as we speak here in 2026, is statins for high cholesterol. I would argue that there are safer options to lower cholesterol than statins. Number one is diet and exercise.
It sounds so easy. Why aren't we doing it? Why
Right.
aren't we doing it?
Well,
Eat the right food, eat your fruit and vegetables, have good, protein, blah, blah, blah. Get out there and exercise. Sometimes connect with the planet, ground yourself, but we're not doing it.
right. So unfortunately, as I mentioned earlier, there's advertising getting us to do things that are not in our own best interest, trying to get us hooked on salt, oil, and sugar, processed foods that sure will make companies lots of money, but will unfortunately prematurely age us. The statins are a little bit different. The statins are, you've got physicians based on standard of care are required
Yeah.
to prescribe a statin. Otherwise, they're going to get in trouble from their board. And there are published studies
That sounds
showing.
like a pharma issue to me.
Yeah,
Sorry.
yeah, yeah. So,
Yeah,
but
we can
Girl,
go a whole nother direction there.
prescribe
right.
statins? That's scary.
So it is scary, and especially when I see patients when they start on statins, they develop muscle weakness, muscle pain, and
Yep.
they also get cognitive problems. And then when they stop the statins, in many cases, not all, but in many cases, they're thinking their cognition gets better. So after seeing too many patients like that, I'm like, no statins for my patients. There are other options, both pharmaceutical and lifestyle. But again, there are other physicians out there who don't agree with me, which is fine. You
Yeah.
want, and I think that's one of the important things is if you're not happy with the experience you've had with your own physicians, get a second or third opinion because fortunately there's more information out there now.
Absolutely. When I was even looking at some of the labs, right, they're trying to get cholesterol low, 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 but some of the research actually shows you don't want your total cholesterol less than 150 for brain health.
Well, I mean, the way I interpret it is most of my patients who have issues with their brain, vascular, the health of the blood vessels are part of it. And the way I look at this is that the ideal total cholesterol is actually going to be under 150. You're right. There are experts out there advocating for higher cholesterol. I just don't see it
Got it.
when
Okay.
I look at the data. So, but guess what? There is a lot of information out there, and there's a lot of misinformation.
Yeah.
But for everything I see, um, most of my patients are not deficient in cholesterol because my patients make enough cholesterol on their own. They don't need extra from food sources,
Right.
etc. So,
Right. Well, thanks for going there because I know a lot of people aren't brave enough to they don't want to get into those tough discussions, but I think that's where we're at now, right? Is I think some of these tough discussions have to be had so that people, if nothing else, they're more aware and ask the right questions to their physicians or seek out. I mean, Dr. Josh, you have people that come from all over the world to work with you for a reason because you're looking at the whole model.
So can I ask a question about that? Because I'm sure you're
sure.
available for people to call you and get information or sign up as a client. But if people don't have the resources to get on a plane and fly to you and have you, work with them, what type of qualifications, degrees, or whatever, if you're looking for someone who is in tune to the time, the TIME, concept, and we'll look at you holistically and not just do Western or Eastern medicine exclusively. What does that look like as far as a practitioner?
Right. So, first of all, I would interview more than one person before you find that person. Uh, I would find someone like myself who's integrative, who is open to ideas. I mean, I did lots of formal training in emergency medicine. I'm board certified in emergency medicine. I'm also board certified in lifestyle medicine. So I would say search for someone who's open. I have a weekly podcast on Alzheimer's that's free to watch. It's called Alzheimer's Breakthrough with Dr. Josh, and I get to interview every week experts on Alzheimer's around the world, and that's I think one reason why I'm able to share this with my patients because I I'm seeking out that information, whereas most neurologists and most physicians I know, it's they don't have time to go to conferences to seek out the latest and greatest. And but when I go to a conference, literally there'll be 30 new treatments, potential treatments for Alzheimer's that I can introduce to my patients. And then I have to decide of these 30, well, which are the ones that
That
make the most
resonate with me.
sense?
Yeah.
Exactly. So if you seek out if you find someone and they're not talking to you about the latest and greatest cutting edge treatments for a difficult disease like Alzheimer's, I would keep looking.
And what would be those like specific questions, Dr. Josh, that they could ask their doctors that they are interviewing?
Sure. So what I would ask them are, I mean, you raised some great ones. Like I heard that statins are controversial. Are you okay if I don't start on a statin? I heard that hyperbaric oxygen may be helpful for Alzheimer's. Are you okay with something like this? I heard that it matters what I eat. Are you okay if I talk to you about my diet or talk to your nutritionist about diet? Another one would be explain to me how you've changed your practice when it comes to Alzheimer's or whatever disease it is
Mm.
in the last 5 years.
Oh,
Uh,
that's good.
Yeah.
Yeah. So otherwise, they're not staying up to date on the next thing that um, could be a breakthrough. Well, we kind of started this with, I've felt kind of scared of the topic, but now I'm curious. Now I
That's
want to
great.
go do my own research. I want to dig in a little bit and find out, like, okay, and start paying a little more attention. Tina and I keep on saying that we have these experts come in and they teach us all this stuff, but then sometimes we're not doing what we're being taught to do and which we know, like taking time to exercise, taking time to pray or meditate, taking time, just to calm yourself as a caregiver, the eating, all the stuff. It's just, I find it very fascinating now. So I kind of losing my fear. I'm losing my fear, Tina.
Good,
Well,
good. I'm glad. Well, it's
that's
interesting
great news.
because I asked you, Dr. Josh, about the headsets of brain tap. And I recognize for myself, like I said, I was getting a little worried. And a lot of it is because we have all these things going on, right? We're building an assisted living. We're got the caregiving company going, and and life. Just it's a busy season. And
Right.
I was catching myself feeling very overwhelmed. And I'm like, okay, Tina, you know what to do, and you've had experts. And even after talking to you, I'm like, it's time. Like, I have to practice what I preach. And I want to encourage anyone listening to this, like, just stop, and we can all like move forward today. Because sometimes when we haven't, paid attention, we almost feel like, well, it's kind of too late. It's not too late. We can all start right here. And so
Yeah,
I
I mean, that's what's so great. Every day is a new day. And you can make a new
absolutely,
choice. I mean, and the thing that I think is so powerful, we all know this, I'm preaching to the choir here, is it's up to you. It's up to the individual to make these choices.
yeah,
Nobody else is like bending your elbow. That's what I say. Nobody's bending your elbow, putting your hand into your mouth, putting so we are it's just being conscious, being
yeah.
very conscious of the choices, making smarter, better choices for yourself. And there's something that kind of has to happen inside where you just say, Tina and I are women of faith, so we don't. I hope this doesn't put you off. But like, okay, God, give me a little direction here. Okay, God, help me make a wise choice. Okay, God, like sometimes when you call out for some support, maybe it's a sister, maybe it's God, and just like reach out for the help that you need wherever you need it, and it's a good thing because I mean, we're all meant to have beautiful, healthy lives. I believe that God created us perfectly. We're just the ones that screw it up,
Right.
making bad choices for
Right.
ourselves. We do,
And, and,
He created these beautiful miracles, these health driving machines, right? I mean, these are like machines that know how to heal themselves, but we get in the way of the healing.
right. And then part of that is self-compassion. Be good to yourselves.
Right.
Absolutely. Have a little grace on yourself. Well, I made wise choices for a week now, literally.
That's
And
awesome.
I'm even doing, a whole week of just really, like focus, because I think sometimes it's like any habit. You can create a habit in how many days, right? It takes doing it repetitively. And so sometimes you have to, just give yourself grace if you mess up that day and just keep going. But yeah, so talk a bit, if you wouldn't mind, about different brain, because I keep hearing about brain training. Like, I've been using the headset we talked about, but there's a lot of modalities out there for the brain training as well as one of the treatments. What are some of the suggestions that like, or the ones you like the best that are out there?
Right. So in general, I love the idea of brain training, biofeedback. You mentioned Brain Tap. I'm a fan of Brain Tap. There are other devices like New Calm that will for patients with anxiety or that will also calm their brain. But I also like going to an expert on brain training where they'll actually do what's called an EEG electroencephalogram to measure the different electrical activity in different parts of the brain and then give the person an exercise and allow them with biofeedback to calm their own brain using that biofeedback. So that is powerful, that you have the power to in breathing, but also with some of these exercises with this brain. So to me, it's not the device as much as finding the expert in brain training that can actually guide you through the process.
And do you have someone on your team that does that as well, Dr. Josh?
I do, yes.
I assumed you probably did. He's like the one-stop shop for the brain.
Wow.
I love it.
Yeah, yeah. I mean, I'll put a plug in for Mike Cohen. I've got a recent podcast interview for him, but I mean, there are other good brain trainers out there.
I love it. That's awesome. As we close this podcast, you've been just a wealth of knowledge. Amazing. And one of the things that we always try to focus on is laughter and joy in the midst of this difficult season. And when you think about Alzheimer's, you think about dementia, as a whole, it's not easy. And so, what would be just maybe a story that you have that could just lift us up, kind of, help the caregivers think about it, another way to have a perspective of looking for the joy and laughter in this difficult season?
Yeah, so I'll give one example. I have a patient who, with Alzheimer's, who's getting better, but she's not there yet. And at the end of every visit, she'll say, "You know what? The next time you're in Florida, you should come visit." And when she says that, I'll look around and I'll say, "That's good, but there's one problem. We're already in Florida." And then so the last time she said, "Well, good, come
Oh.
visit me now." So
Come see me now. I
yeah,
love
Oh,
it.
that's so sweet.
That's so
yeah.
sweet. Well, we appreciate you. We're going to have all your links down below. And is there anything else you'd like to leave with for a caregiver that might be watching, whether it's for their family or for themselves? Um, what would that piece of advice or that one thing you might want to leave them with today?
Yeah, I would basically say two things. Number one, there is hope. There's hope with Alzheimer's, or if you're taking care of another chronic condition. But number two would be to re-emphasize the self-compassion, because as adults, we are not designed to take care of another adult 24/7. It's just we're not wired that way. So if
Mm.
you find that you're overwhelmed, instead of blaming yourself or blaming someone else, as you said, seek out help, because if and I've seen this so many times, whether it's Alzheimer's or other chronic conditions, what tips people over into the disease is normally stress. So
Mm.
if we can't lower your stress as a caregiver, you're not going to be very effective lowering the stress of the person you're taking care of. So yeah, so it would be hope and self-compassion.
I love that. Thank you so much for being with us today.
Oh my gosh, it's like I'm not scared about Alzheimer's anymore. And this was such a great conversation.
So join us, pull up a chair, you're strong, you're seen, you're right on time. We laugh, we love, we share, we laugh so we don't cry. Join us!